Hi, my name's Gabriela Fuchs. I'm a doctor in clinical genetics at the Leicester Royal Infirmary. I'm going to talk to you a bit about gynecological cancers today. Gynecological cancers include cancer of the ovary and of the endometrium, which is otherwise known as the womb. A small proportion of these cancers can have an inherited component. Ovarian cancer has been linked with breast cancer and also other cancers such as bowel. Endometrial cancer can be linked to bowel tumours. By looking at the histology under a microscope of these tumours, this can give us clues as to whether cancer has an inherited component. For people with an inherited susceptibility to either of these types of tumours, the risk of developing cancer increases from about 35 years. I'm now going to talk to you about some of the options for screening, and that means picking up the tumours at an early stage, and the options for management of people at risk of these types of tumours. First, I'm going to talk a bit about ovarian cancer. Ovarian cancer is a difficult tumour to diagnose early, as there aren't really many symptoms associated with it. The symptoms are generally quite non-specific, such as bloating, decreased appetite, and sometimes people might get backache or indigestion. At present, there really isn't any clear consensus on screening in ovarian cancer and whether it can actually save lives. The UK Fox study has recently closed, and this is quite a large study that's looked into the use of a blood marker, which is called the CA125, and an ultrasound scan to detect tumours early. The CA125 may miss some tumours, and it may go up for other reasons. It can also be difficult to distinguish between cysts and cancer on an ultrasound scan. The results of this study should be available by about 2012 to 2014, and they'll hopefully give us a bit more guidance as to which screening to offer for patients who are high risk for these tumours. Patients who are in these very high risk groups might be recommended surgery to remove their ovaries. I'm now going to talk a little bit about endometrial cancer. Endometrial cancer usually presents either with postmenopausal or intramenstrual bleeding, and if you develop either of these symptoms, you should seek medical advice. Endometrial screening is offered to those people in high-risk groups, and it consists of annual ultrasound scan and also a hysteroscopy, which is where you take a camera and look into the womb, and at this point they may also take a biopsy. There is some suggestion that fitting progesterone-releasing coils can decrease the risk of endometrial cancer, and this may be offered to you if you are high risk. For ladies who have completed their family, they may be offered a hysterectomy. Decisions for surgery aren't made quickly. Patients in high risk groups would be seen in a joint clinic with gynecologists, geneticists, and there may be additional support from genetic counsellors and clinical psychologists. This is so that the patient has all the information before they embark on any kind of procedure. Thank you for taking the time to listen to this podcast. I hope you've found it helpful. If you have any further queries, please don't hesitate to contact the Clinical Genetics Department at the Leicester Royal Infirmary, and the number is 0116 258 5736. Thank you.